Joining us today on Morning Blend is Dr. Shaga DeNoble. She is a board-certified gynecologist. Dr. DeNoble, welcome to Morning Blend. Talk about why we're seeing an increased rate in advanced stage cervical cancer.
Yes, we're seeing increased rates in advanced stage cervical cancer. This is a study done until 2018, which is very disturbing. We think the rates are due to access to care because screening is actually done well with pap smears, and we have good rates of pretty good rates of HPV vaccination. But we're seeing higher rates of the advanced stage, not overall incidence. So we think women are missing going to the gynecologist, getting their pap smears regularly done until they see symptoms, which sometimes is too late.
What demographic are we seeing the numbers increase most?
We're seeing the most increase in white women ages 40 to 44.
Okay.
And these are women that live in the South in more rural areas. And you know, this raises the suspicion that access to care is an issue. There are many areas throughout the country where there are not that many gynecologists for patients to go see regularly.
So what's the answer to that then?
Yeah. Well, you have to make sure you go to your gynecologist every year. You know, recent guidelines do indicate that we can get our pap smears less frequently, more every 3 to 5 years. However, you still have to see your gynecologist. And when a woman is trying to get their pap smears every 5 years, they're going to forget when the last pap smear was. You know, was it last year? Was it, 4 years ago? 10 years go by and you haven't been screened. So you have to make sure you see your gynecologist every year. Okay. And certainly if you have abnormal symptoms, you have to be seen. Don't just ignore them.
Yeah. Well, and it's interesting because there's some confusion. Even I went for a pap smear last year, and the gynecologist said, well, you're not due for a pap smear, but we can do an exam. And I thought, okay.
Right.
My primary care says, no, you need to get that pap smear. Okay. Yeah, it's confusing.
Yeah, very important. It can be very, very confusing. So I always tell patients you should see the gynecologist and get an exam every year.
Okay.
Now, whether you get the pap test done or not, the doctor will know when to do that. You might not need the actual test every single year, but you do have to be examined and seen every year. Because sometimes you might not be due technically for a pap smear, but based on your symptoms, the doctor might say, you know what, we're going to do one today. And that's where the confusion, I think, leads to problems.
Just a few seconds left. What are some symptoms for women to look for?
Spotting after sex, spotting between periods, pelvic pain, and new bladder symptoms.
All right. Really got to take care of it. Keep on top of our health. Thank you so much, Dr. DeNoble. I appreciate the work you're doing and getting that word out and reminding us all that we really need to stay on top of this. Go check with your gynecologist. If you don't have one, find one, get a primary care doctor. We got to stay in front of this because we have to be our own advocates, right?
Absolutely. Thank you for having me.
Thank you. If you want some more information, go online in your area to find out where you can find some primary care and a gynecologist as well. Thank you. Take care.